As COVID cases continue to go up and mask mandates go away, many are concerned around Connecticut and the country that they could be at risk of moving in the wrong direction. Fox 61's Gabby Molina joining us live in Hartford tonight with what health experts are saying tonight. Gabby.
Ben, the chief epidemiologist here at Hartford Healthcare says that he believes that we're already moving in the wrong direction when it comes to COVID-19. But he says that mask mandates being repealed are only one reason why we're seeing that rise in cases. An uptick in COVID-19 cases in Connecticut is being driven by a number of factors.
Herd immunity is going lower, and then vaccine immunity is also waning to a certain extent. And then there's the big reason, which is the Omicron variants as well. Elimination of masking certainly has contributed to it.
But even as numbers go up, more people are going maskless. Public transit, the latest to ditch the mandate. Dr. Ulysses Wu, chief epidemiologist at Hartford Healthcare, says his advice is for people to do the things we already know protect against COVID, such as getting vaccinated, staying on top of booster shots, and in certain scenarios, still wearing a mask.
It should not be binary. It should not be COVID doesn't exist or COVID rules everything and we should cease to live our lives normal like we normally would. There is something in between.
While many people are happy to leave masks behind, there seems to be a consensus that people should do what they're most comfortable with.
I think it's absolutely time. I think people who want to wear the mask, they should still have the ability to wear it.
I think it's time for them to be lifted, but I am a little concerned because as cases are going up, so I'm kind of split on it. Whatever science tells us, I think we should keep doing that.
It's a concern for those who are at a higher risk, though. Disability Rights Connecticut worries that it's too soon to get rid of masks in places like public transit.
I think that there should be the guidelines in place, especially in places where it's really likely that there could be a problem, like at school or in an airplane, for example, when everybody's in close quarters.
The CDC agrees, asking the Department of Justice to appeal the ruling that struck down the mask mandate. In a statement, the agency said in part, when people wear a well-fitting mask or a respirator over their nose and mouth in indoor travel or public transportation settings, they protect themselves and those around them, including those who are immunocompromised or not yet vaccine eligible, and help keep travel and public transportation safer for everyone. As of right now, there is still no federal requirement to wear a mask on public transit, but it does depend on the service. So, for example, here in Connecticut, Metro North is still asking passengers to wear a mask. Also, anyone that feels more comfortable wearing a mask is welcome to do so on any form of public transportation. Live in Hartford, Gabby Molina, Fox 61 News.